but they do a horrible job in keeping people alive much longer, which ultimately is what you want to do. You want overall survival. Let me give you an example. Avastin, bevacizumab. This is an immoral drug that should never be used on people. It was blocked because it caused colon perforations in women with breast cancer. They still use it on brain cancer. And when in the tumor, you get a tumor, you can see it with PET imaging, and you can, not so much PET, MRI and CAT scan, you can see it there. And it's looking there. Okay, you can see it. Now you give the patient Avastin, and which is this anti-angiogenic drug. It's supposed to stop the abnormal blood vessels, right? They think that the angiogenesis blood vessels is driving the dysregulated growth. It's the fermentation that's driving the dysregulated growth, by the way. So all of a sudden you give the tumor kind of disappears. It doesn't look like it. Whoa, patient gets all excited. The physician looks and says, look at that, looks like you're doing well. What it does, what the drug does is it causes the tumors to permeate your entire brain, just like spreading it through your whole brain. You don't live any longer, but you had this progression free. Look at the tumor. So the patient gets excited because it looks like the tumor's disappearing with this very expensive drug. But what it does is it almost guarantees that that patient will not survive because you spread the tumor cells through the whole brain. So this is why I call it an immoral kind of a thing.
But chemotherapy and sort of these radiation therapies, they have proven to keep people alive who otherwise would have died,
In
right?
some cases, it can, and that's another thing we have to look at. I work heavily in brain tumors and glioblastomas and things like that,